Okay, patient taking iron and calcium should be separated because, of course, as you know, calcium affects the absorption of iron, so minimum 2 to 3 hours gap between them, and if it is more, it will be better. Patient taking thyroxine, so it should be taken on empty stomach at suhoor or at bedtime. Now we finished. Of course, there's a lot of needed information, but I tried as much as I can to make the lecture simple. This is our reference. Now we will go for fasting cases to uh, examine your understanding for the lecture. Case 1, male patient, 52 years, he's type 2 diabetes for 8 years. His medication metformin 1000 milligram BID, sitagliptin 100 milligram OD, HbA1c 7.2, renal function is normal. First question, can this patient fast? And if he will fast, what changes are needed? Before we answer, first I need to classify this patient. From which category this patient is? High risk category, should be exempted, or moderate or low. Patient has type 2 diabetes and he's taking many medication, but in general HbA1c is normal, and his condition is stable. So this patient is moderate risk. Okay, then what changes are needed? Metformin 1000 already BID. I will shift to iftar and suhoor. Sitagliptin no change. It will be after iftar because of hydration. This is from sodium glucose like transportase inhibitor. So no change, but I will advise the patient to avoid dehydration. Case 2, patient female, 60 years, type 2 diabetes, medication metformin 1 gram BID, glibenclamide 5 milligram BID, HbA1c 8.5. So this two common questions. First, fasting safe, and what would you change? First, the patient is here HbA1c is 8.5, but she's 60 year, so consider stable. And sulfonylurea, this is our concern. The the type of sulfonylurea which is taking has high hypoglycemic risk, so better to change to either dipeptyl peptidase 4 inhibitor, or the sitagliptin, vildagliptin, or glycoside MR. And also dose reduction is required, as we said, because if it is taking BID, so the normal dose after iftar will be normal, and the evening dose after suhoor should be reduced 25 to 50% according to the patient response. If the patient has high hyperglycemic risk, or the patient is uncontrolled, I'm talking about another case, not our case. So I will not take the decision to reduce the dose if she is uncontrolled on her current dose. Case 3, patient male, 58 years, type 2 diabetes, on insulin, medication glargine, 30 unit at night, and metformin. Question, how to adjust insulin? First, before adjusting insulin, I need to classify the type of insulin. This is glargine long acting. So long acting, we said that we need to adjust 15 to 30% initially, then monitor glucose frequently and individual titration from patient to patient, of course, as we said. Basal insulin can often be continued safely with monitoring because it's long acting or taken after iftar, then I will monitor during the day. Case 4, patient male 67-year hypertension and mild heart failure. Medication furosemide 40 milligram morning, bisoprolol ACE inhibitor. What adjustment are needed? Of course, I have diuretics. Furosemide, this is the most high-risk medication. Bisoprolol, beta blocker, and ACE inhibitor. Both diuretic and ACE inhibitor has high risk of hydration. So what is the advice I need to tell patient? Monitor blood pressure and dizziness. Move diuretic to iftar and educate about hydration. And diuretics are among the most important medication to adjust. If I can, diuretic medication, it is not like a regular chronic medication which should be taken for last lifelong like this. It is like as needed medication. If the patient has volume overload, like any signs of edema, pulmonary congestion, peripheral edema, pulmonary hypertension, for example. So if the patient condition allow me to skip diuretics during Ramadan, of course this decision will not be for us, it will be for physician, but I need to like highlight for physician or for the patient to ask his doctor if it is possible to skip diuretics in the Ramadan or at least reduce the dose. Patient female 65 years CKD stage 3 diabetes controlled medication metformin empagliflozin from Skillet 2. So question, should she fast? This patient is, she has two conditions like diabetes and CKD, but his condition is stable because he didn't mention for me at the case that any abnormal symptoms or abnormal lab result or something. So she is moderate risk. So assess hydration and consider holding sodium glucose like transportase inhibitor if dehydration risk high and if her blood glucose controlled. Question 6. Patient check glucose at 2 p.m. while fasting, the reading 65. Should patient continue fasting? While at the fasting time, daytime, he found that his blood glucose 65. Of course, this condition from the threshold which we mentioned that if I if it is it happened, the patient must stop fasting and immediately taking anything to increase his blood glucose. Because we said that less than 70, the patient shouldn't fast and he need to break his fasting properly. Must break fast and according to religious and medical point of view, it is not allowed for him to fast. Case 7, patient female, 35 years, hypothyroidism. Medication levothyroxine daily morning before Ramadan. Question, how to take during Ramadan. Of course, thyroxine from the medication which affected by food should be taken on empty stomach. So before suhoor or 3-4 hours after iftar, empty stomach essential. Case 8, patient male 70 years atrial fibrillation which has arrhythmic problem medication apixaban BID. What to do? Apixaban from the DWAX direct oral anticoagulant. So it must be shifted from BID to iftar and suhoor. It has no risk, but I must not to skip the dose and also monitor the renal function. Although apixaban from the least drugs which affect the renal or affected by renal condition, but also to be point of care. Case 9, patient female, 28 years, epilepsy controlled. Medication, levetiracetam. Question, can she fast? If it is for epilepsy, if it is uncontrolled, this patient is high risk, shouldn't fast. But if it is controlled, okay, but I need to keep the doses on its proper time. High importance of adherence. See here, adherence for anti-epileptic and antibiotic is very important. Consider extended release if possible and the neurologist input, which means monitoring. Last case, Mr. Fatima, 72 years, medical history, heart failure with preserved ejection fraction, hypertension, mild CKD, EGFR 45, current medication furosemide 40 milligram twice daily, lisinopril 10 milligram once daily, metoprolol succinate 50 milligram once daily, aspirin 81 once daily. Recent events, hospitalized 3 months ago for heart failure exacerbation. Patient statement, I know I am exempt because of my age and health, but Ramadan is so important to me. I want to try fasting. Can I? Actually, at this point, you need to matching between the medical point of view and the religious point of view and the patient point of view. Some patient, even the religious or medical point of view prevents them from fasting. You can't by any way convince them to stop fasting. But your first decision at this case to protect the patient from his like wrong decision if he continue fast he insisted to continue fasting, so you need to convince him by any way, and here your communication skills must be as higher as possible to convince the patient not to fast because he's very high risk. Okay. And because he recent hospitalization for heart failure less than 6 months, advanced age, and the high dose loop diuretic, highest dehydration risk, and CKD stage 3 also. But if the patient insists to fast and you don't have any option to stop him from fasting, then you need to give your general recommendation and monitoring to keep hydration status always, to check his or her blood pressure daily, and renal function every some days. Also to confirm that there is some people around here, if any condition happened, this is your role as a pharmacist, because pharmacist is a multitask person who doesn't care only about the medication, he's caring about the patient from his health point of view and also from his satisfaction and from his psychological. So no one except you will do this rule. Actually, by the end of our lecture, I would like to thank you all to listen this long lecture. And if any question or something, I will happy, or any comment or any modification, because actually this lecture is prepared fast. So if we miss any important information or if we confused to tell any inaccurate information, I would like to hear from you to correct it. And I wish for you all happy, acceptable worship in Ramadan. May we all find peace and patience during fasting. Ramadan for Muslims is a very good point of a change, of achieving whatever you want, Each one of us has a lot of secrets inside him or her, has a lot of dreams, a lot of thoughts.